Okay, so starting upper right, so 8, 7 is missing, 6, 5, 4, 3, 2, 1, upper left. Oh, okay.
If at any point the patient seems unwell, stop treatment, make the situation safe, get help, and locate your medical emergency equipment, including treatment algorithms.
All right, Mrs. Jones. Okay,
oh my God.
All right, there. Okay, we'll take the glasses off. Okay. Oh, Mrs. Jones is a known epileptic, isn't she?
Yes, she is.
Okay, yeah, I think she's fitting here. So if we can get the rucksack and get some more help, that'd be great.
Some help, please.
Okay. All right. Okay, so if we should start off with some oxygen.
It can be really difficult to do an ABCD approach whilst the patient is fitting. So focus on oxygen delivery, and if the fit is not normal for the patient, treat with midazolam.
Oh, hi, Anthony. Just hang on here for a second.
Did you get something in her mouth?
No, it's okay, Chris. Let's just get some oxygen for me. So if we connect the tubing to 15 litres. How long does a fits normally last?
It normally lasts a minute.
Oh, okay. All right, so we'll give it a minute to work. Don't panic. This is very normal for Mrs. Jones.
Should the patient become unresponsive, or if you are at all worried, don't be afraid to activate emergency services early.
So, Anthony, I think we're getting towards that time now. So if you can dial for an ambulance for us. Tell them we've got a known epileptic who's fitting and that we need an ambulance to come and give us a hand. Okay, so what's the adult dose for midazolam, Chris?
It says 10 milligrams here.
Okay, so nice and calm, Chris. If you can get me 10 milligrams out, because we're going towards nearly that minute time up now. It's okay, Mrs. Jones.
Yes, that's the correct address. Yes, that's the correct phone number. No, she's not conscious. She just had a fitting. She's breathing, but not normally. Okay, I'm waiting for the car. Thank you.
Oh, hi, Anthony. Can you get Mrs. Jones's notes? They're at the back there. And just start writing down everything that we've done.
It is important to document what happened as it happens if possible, to ensure accuracy of times, drug doses, and the condition of the patient.
So,
okay, 10 milligrams. We've just given her 10 milligrams of midazolam at 10:05. Oh yeah, I can see she's relaxing now. She's stopped fitting. Okay, there's some secretions in her airway. Chris, can you get a suction machine for me? If I can ask you to suction while I manage her airway. That's it. Oh yeah, she's getting a bit sleepy now. You're nice and safe. Okay, nice and gently.
When the patient has stopped fitting, consider using an oropharyngeal airway if the patient will tolerate it.
Can you get an airway out for me, Chris? That's lovely. Cool. And if you want to size that up, no, go on, you can have that a go. Okay, see if she'll tolerate
no,
that.
she's biting down on it.
Lovely. Okay, so we won't need that. If you can get the SATs monitoring on, Chris, and count the respiratory rate for me as well.
Count the respiratory rate. Attach oxygen saturations if you have it. Consider the colour of the patient and look for normal chest movement.
91%.
Okay, good. So while you're down there, if you take a pulse, and I'll do the capillary refill time.
Feel for pulses. Assess capillary refill time and check blood pressure if you have the equipment. Also feel the skin temperature.
The capillary refill time is less than 2 seconds. Chris, you can put a blood pressure cuff on that arm for me. And while that's doing that, Chris, could you do a blood glucose?
In disability, assess level of consciousness by using the AVPU score. Check the patient's blood sugar levels, and if they're conscious, ask them to move their limbs to look for any signs of weakness. Exposure of the patient in the dental setting can be difficult, so whilst respecting dignity, look for signs of rashes, bleeding, injury or bruising.
Anything else
I think she's wet herself.
Okay, not a problem. Okay, so we'll just wait for the paramedics to arrive now. We'll just draw up another 10 milligrams of midazolam just in case, but I don't think we'll need it. But if we do, we've got it ready.
After exposure of the patient, reassess using your A, B, C, D, E approach.
Hello, paramedic here.
Oh, hi, thanks for coming. This is Mrs. Jones. She's a 60-year-old patient who's post-ictal. She's a known epileptic who takes Tegretol. We were doing a procedure and she started fitting. Her normal fit time is about a minute, and these went over a minute. So we've given her 10 milligrams of midazolam. She's stopped fitting. Airway, we had some secretions in there, but we've cleared that. Respiratory rate is 10, SATs of 91%, good colour. Pulse was 120, capillary refill time is less than 2 seconds, BM is 6.1, and she's been incontinent, so we're over to you now to give us a hand.
Okay, thank you. Can you get me a copy of those notes? I'd like to get some IV access.
So in summary, if someone starts fitting, stop dental treatment and make the situation safe. Do not restrain the patient or put anything in their mouth. Call for help and give high flow oxygen with the correct oxygen mask near the patient's face. Find out from their notes what is their normal fitting time and prepare 10 milligrams of buccal midazolam. If they continue to fit more than normal, or for more than 5 minutes, or stop fitting and start fitting again, give the midazolam. If the midazolam does not stop the fitting, prepare for a second dose. When the patient stops fitting, assess them using the structured airway, breathing, circulation, disability and exposure approach. Use algorithms to remind you of the treatment guidelines and ensure the emergency services are called early. Prepare for handover, document what happened as it happens and debrief your team after the event.